everyone. This is Casey Wolfington with Eagle Valley Behavioral Health, and I'm here with Joe Hess from Colorado Mountain Medical. We want to talk to you guys today about Omicron and some of the impacts on our pediatric population. Previously, with the other variations of COVID, oftentimes our youngest individuals were not as seriously impacted. But that's changed a bit with Omicron, and we're getting a lot of questions about it. So, Joe, tell us a little bit what we're seeing.
Yeah, sure. Thanks. What we're seeing is Omicron impacting the unvaccinated mostly. And the unvaccinated that we're talking about today are those kids 5 and under who are ineligible for the vaccine. They live with us. They run around the house. They go to school. They do all these other things. And we want to keep them safe. And there are some best practices to try to keep the kids safe. And one of them is to help them wash their hands, keep clean, make sure that they're wearing their mask if you have a mask for them, because it's up and down. This mask is going up and down all day long. I've been a pediatric nurse for 20 years, and I've worked with kids of all ages, and believe me, I know how hard it is. My kids, myself, they're older, and I've been through this. But with the youngest kids, if we can create some of these habits early, so then that way we can protect them. That's just one way.
That's fabulous. And, you know, I think with parents, this can be really scary. This is really hard, and it's often confusing. We don't know what to do if our child's experiencing symptoms. We often want to say, well, this is probably just a cold. But what do you think parents should do if their child's experiencing symptoms?
Yeah, I think there would be 2 things that I would like to focus on. One is, we have visitors coming to our homes, and right now, I would ask visitors, are you feeling well? Are you experiencing any cold symptoms? If they are, let's reschedule that visit, because likely they probably have been exposed to COVID, and they very well may have the Omicron variant of COVID. The other thing is, we get busy, and we have to go to the grocery store, the post office, or the Home Depot, wherever we're going, and our habit is we want to take our kids with us. Maybe leave them at home. Maybe there's a caregiver or somebody else, an older sibling, who can watch them while you go out and do the errands that you need to be able to do. So, we can't protect them all the time, but we can do our best, and this is just one of the ways.
Absolutely. So it's such a great reminder to remember that we have protective measures other than vaccines to keep individuals safe. And then if you are a parent and your child is experiencing symptoms, what do you recommend, Joe?
They can certainly schedule an appointment with one of our CMM offices if they're really ill. Otherwise, monitor their symptoms. And if they start having increased breathing difficulties and they are irritable and can't sleep, definitely see about coming to one of our urgent care centers or scheduling an appointment for them to be seen, especially the youngest ones.
Absolutely. And the earlier they can get seen, the better, because that can help us prevent serious illness or anything escalating beyond our control. I think the other big thing as parents is just remember that this is a lot. The past 2 years have been incredibly hard, and everyone's doing their best. So when you're hearing this advice, just remember to make the decisions that are the best for you, the best for the kiddos, and the best for your family. You guys are doing awesome. Hang in there.